First community conversation, we're joined by Dr. Nicole Fowler, Director of UVA Health's Division of Head and Neck Surgical Oncology and Reconstruction. She's sitting down with her.
Dr. Fowler, we appreciate you coming in today.
Thanks so much for having me.
You're very welcome. So today's topic is recovery after head and neck cancer treatment. So what are some of the most common recovery issues that patients face?
The first is that when you've had head and neck cancer, it's really affecting your mouth, throat. This is where you speak, this is where you talk, this is where you breathe. So swallowing is very important, the way that we communicate with the world. So number one is speech, language, communication, nutrition, and how our patients are doing in terms of their overall weight loss. Also, how we breathe is essential, and whether or not they've had to get anything like a tracheotomy or something to help them with breathing. We also deal with just overall body concerns, again, just in terms of whether or not they've had any changes to their face or neck in these surgeries. And
how do you and your team work with patients on their recovery?
Absolutely. So we have an entire team. The speech language pathologists are one that help with speech language communication, swallowing. We also have physical therapists, occupational therapists that help, especially if we've had to take tissue from one area of the body and move it to another area of the body. We have an amazing team of nutritionists who help with those concerns when it comes to nutrition or weight loss. We have palliative medicine specialists, because it can be really painful. This is a particular area where it can really hurt, cancer pain especially.
Right. And then how frequently do patients need to return for follow-up visits?
A lot in the beginning. It can seem daunting right after their cancer diagnosis. So especially in the beginning when they're first diagnosed, we see them about every 2 months. And then after that, it can spread out. So 3 months, 4 months, 6 months, and then once a year. Typically at these visits, we're checking where the cancer was first seen, as well as the neck lymph nodes, which is a place that the cancer can spread to. And then from there, we'll check things like the lungs and other places.
And then how long does it typically take for patients to recover? I know it probably varies depending on the patient, but on average, how long does it take?
Yes. As you said, different for everybody, but typically a few weeks to a few months for the first patients, especially trying to get back. A lot of patients don't just want to get back to where they were when they had cancer. They want to get back to where they were functionally. Let me get back to work. Let me get back to my life prior to their cancer diagnosis. So that can be a few months to get them back to that functional result. But from there, we expect that they're going to be able to do that, and that's what our team is so good at helping them with.
That's wonderful. I know you all are a very impressive group of people. So we appreciate what you do. And thank you so much for coming in today, Dr. Fowler. It was great.
Thank you so much for having me.
You are very welcome. Steve?